Good day, ladies and gentlemen, and welcome to our webinar this evening on Gynecomastia, brought to you by George Pope and the staff at the Orlando Plastic Surgery Center. My name is Matthew Lyon, and I'm delighted to be serving as your host for today's session. A few items before we get started that we'd like to note about your console area. You can participate with us and provide us with questions throughout today's session. We've set aside time at the end of our presentation when we'll address those. To do so, you can type into the chat area and be sure to click on the submit button so that'll transmit over to our team. You can also use this area if you're having technical difficulties. We have team members standing by that'll be happy to assist you with those as well. I'm going to take a moment here to just review some of the items that we'll be touching upon. We do want to do some introductions and talk to you about the practice, also education and background of Dr. Pope. He's going to walk us through the patient cases and a number of options that are available for folks relative to this process, and also share what the experience is for many folks as they engage in this. It is worth noting that the Orlando Plastic Surgery Center is conveniently located just south of downtown Orlando off of Orange Avenue. You see the address and the beautiful facility there. You'll find the address and information for contacting the staff. Additionally, we'd like to call attention to the fact that here at Orlando Plastic Surgery Center, they do have their own surgical suite that is available for folks. Something that's very nice about the practice is that you can come here and the services are provided on site. In addition to being AAAASF accredited, it's also very convenient access and provides a one-to-one patient experience. The team is board-certified anesthesiologists that are on site, and they do provide overnight stay capabilities, as some of the staff will talk to you about a little bit later. The patients have a warming system that also provides comfort to all of the patients in the facility and also guards against any disease or infections that might occur. At this time, I would like to bring forward one of the team members here, and I'd like to introduce to you Lisa Cruz, who's the patient coordinator here with the team. So Lisa, we'll turn it over to you for a few moments.
Hi, everyone. First off, I want to thank you for joining us here tonight. And as Matthew said, I am Lisa Cruz, patient coordinator for Orlando Plastic Surgery Center. I've had the privilege of working with Dr. Pope for over the last 15 years, and it's been my pleasure to work one-on-one with our surgical patients. In addition to the support that I provide you, you will also be supported by our fantastic staff. We really are a family here, and our patients become a part of our family also. After your surgery, we do not forget about you. You can always contact us.
Very good. Thank you, Lisa. I'm going to take just a moment to introduce you to our guest of honor today, which is Dr. Pope. And as you can see here, Dr. Pope has spent a number of years embarking on his education journey to get to where he is. He's also been practicing in plastic surgery for over 24 years. He's had his practice here at the Orlando Plastic Surgery Center for some 7 years at this point. I'd like to also note that he is certified by the American Board of Plastic Surgery. He is a member of ASPS, as well as part of the clinical faculty with UCF and FSU's School of Medicine. Dr. Pope, it's with great honor that we welcome you to the stage. We'll let you take it from here.
Okay, Matthew, thank you very much. And I want to thank you for all of the work you've done behind the scenes and the rest of the staff in making this happen. We're all excited here at Orlando Plastic Surgery Center to have our first webinar, and I want to thank all the participants. We have quite a number of people from as far north as Canada and as far west as Texas, and we have quite a number of people from right here in Central Florida as well. So I want to thank you all for joining us. What I'd like to do in the next hour is talk to you about, obviously, gynecomastia, but talk about some of the causes, some of the symptoms that people who suffer from this may have, and then we'll get into non-surgical treatment. But I think most people who are attending here are interested in the surgical treatment, so I want to make sure that we spend a good bit of time on that. As far as definitions go, and I have a feeling that most people who are involved in the webinar tonight are either have gynecomastia or maybe have a loved one or a family member who does have that. So most people realize that it is a condition where a man has a typical breast enlargement that can involve one or both breasts. Now, it can be asymmetrical. Some men can have, I think the majority really have this affecting both sides, but a number of men have this affecting just one breast and not the other. And this is a picture of one of my patients who had repair on just the one side, and we'll show you that a little bit later. As far as causes are concerned, gynecomastia is caused by an imbalance between testosterone and male estrogen. As you may know, men have a certain level of estrogen. Women certainly have much more, but men have estrogen as well. And when there is an imbalance, that's what can lead to the development of breast tissue. There can be different factors that can cause this. They can be internal factors or external factors. I'll get into that. You can see in the schematic that the breast tissue can be very large, and it can be excessive in a number of people. Some people have just a minor case where they just have breast tissue lying right behind the nipple-areola complex, but many other people, and I'll show you some examples later, can have pretty significant growth, and I'll get into the causes of that. As I said, some are internal factors, some are external. We can talk about the internal factors first. There are a number of medical conditions that can lead to development of breast tissue in men. One that is fairly well known is Klinefelter syndrome, which is actually a genetic disorder where a man has an X and a Y chromosome, which is normal, but has an extra X chromosome. That can lead to some other issues, but obviously gynecomastia is one that certainly comes into play with many people who have Klinefelter syndrome. Aging I have listed as an internal factor. That's something that no one can really prevent, of course, but you see this as men get older and the testosterone level drops. I think testosterone level peaks during your 20s, and as it starts to wane over time, you can get increase in body weight, which unfortunately most of us see as we get older, but that can translate into excess fat on the chest wall and actually in some cases excess breast tissue. There are tumors that can cause gynecomastia in men, as well as situations with the thyroid gland. If you have hyperthyroidism, that could lead to it as well. Certain other organ systems can fail and can lead to problems with gynecomastia. Kidney failure patients have a higher risk of that, as well as men who suffer from liver failure and or cirrhosis of the liver. Regarding external factors, malnutrition plays a role, and that is basically because of an abnormal testosterone level. The testosterone level is low in situations like this, but typically estrogen levels do remain the same. And with that relative imbalance, you can develop gynecomastia. And then other external factors include drugs, both therapeutic drugs and illicit drugs or illegal drugs. And then, of course, alcohol can play a role. Regarding therapeutic drugs, there is a laundry list of drugs that can lead to that. And one of the drugs that I think is the most widely known is an anti-androgen drug, Propecia. It's used for men who want to regrow hair or prevent further hair loss. In larger doses, it's called Proscar, which is a drug that actually is used to help prevent or treat prostatic hyperplasia or enlargement of the prostate gland. So a number of men who take Proscar therapeutically can develop gynecomastia and need to be aware of that and aware that that's a risk. Several other drugs can cause that, and they're listed here. Many of these are cardiovascular type drugs. Some antibiotics can also play a role. Also, HIV drugs can cause gynecomastia, as well as Valium. Digoxin's another cardiac drug, amphetamines, and then there are a number of anti-ulcer drugs, and unfortunately those can all lead to gynecomastia development as well. Now, in talking about illicit drugs, I think this is where pretty much everybody's aware. You know, everybody hears about the guy who is the guy in the gym who is on anabolic steroids, and they certainly can play a role. And I've had a number of patients who admit to maybe just one course of steroid use, and that was enough to cause pretty significant gynecomastia that was irreversible without surgery. Marijuana can also lead to gynecomastia, as can heroin. Okay, regarding symptoms, we'll talk for a few minutes about that. They're pretty obvious. The obvious symptom is chest wall abnormal shape. A man basically develops excess breast tissue, which causes an abnormal appearance or female appearance of the chest. Now, asymmetry is also an issue. As I said earlier, this can happen in many cases where only one breast is involved, but by far the majority of cases involve both breasts. Men can also develop tenderness or even pain in one or both breasts with gynecomastia. But I think the biggest issue that I have patients talk about is a psychological or social problem that they have from basically having appearance of breast on their chest wall. It really impairs self-confidence. Many men in my practice that come in here as patients talk about how they avoid all types of activities because they're too embarrassed to go out without their shirt on. I have men that talk about never wanted to go to a beach party. Many men have even told me they don't go swimming with their children. Avoidance of intimacy is another issue. A lot of men talk about wearing shirts when they're with their significant other in bed, so it's a big issue. As far as risk factors go, I did want to throw this out there, not to alarm people, but just to make you aware that of this fact that men with gynecomastia have a 5 times greater risk of developing breast cancer than men without it. Now, that doesn't mean if you have gynecomastia, you're really at a high risk. It's just because you have the gynecomastia. It's related more to the imbalance in hormone levels, and it's just something that you need to be aware of. And many times we'll talk about the need to submit tissue to pathology to be tested. I'll talk a little bit about non-surgical treatment, but once again, I think most people are here to learn more about the surgical treatment. In my opinion, that's by far the better treatment because many times the medical treatment or non-surgical treatment doesn't really do the job. I think if someone has had gynecomastia for more than a year or maybe 2 at the most and still has the problem, it's not going to go away with anything other than surgery. And I think that can be supported in our literature as well, and I've certainly talked with other plastic surgeons who perform a lot of gynecomastia surgery, and that's pretty much the feeling of surgeons who do this type of work. Nonetheless, I would like to go over some of the medical treatments. Obviously, a non-surgical treatment would be compression of your chest wall. Most men with gynecomastia, if they haven't had surgery yet, are going to wear some type of compression shirt. We have a picture here of one that can actually be used post-surgery as a garment, and I put all of my gynecomastia patients post-surgery in some type of compression vest for a couple of weeks, and we'll get into that a little bit later. But a lot of people will wear some type of heavy compression like this just to mask the breast appearance. I know that there are different companies out there that make shirts that are very tight for this purpose, Under Armour being one that's very popular now, and that's one a lot of my patients have worn in the past. But aside from that, we can talk about medical treatment for gynecomastia, and that's basically hormonal manipulation is what we're talking about. I do want to make a point, though, that at this time there are no drugs that are FDA approved for the treatment of gynecomastia. That doesn't mean that they're illegal to use, and a doctor can certainly prescribe those, but none have been FDA approved to really treat the disease. With hormonal manipulation or treatment, once again, I mentioned this a minute ago, it may help during the first year or maybe the first 2 years of gynecomastia development, but after that, medical treatment hasn't really been shown to be that effective. Over some of the drugs that are used, and I have a lot of patients who have come in and they've been treated with different drugs. Some have had some success, others not. Tamoxifen is a very popular drug. It's an anti-breast cancer drug. For women who have breast cancer that is sensitive to, that's estrogen receptor positive, they are candidates for use of tamoxifen. As an anti-estrogen drug, it can tend to help, in some cases, shrink down the breast tissue associated with gynecomastia. Clomiphene, the trade name is Clomid. You may have heard of Clomid. It's used in infertility, in gynecology as an infertility drug, and it tends to bind with estrogen receptors, thereby blocking the effects of estrogen. So that's sometimes used in gynecomastia treatment. Men who are older, as I mentioned earlier, tend to lose testosterone levels, and so use of testosterone in some cases may be found to be useful in treatment of gynecomastia. And then these other 2 drugs listed here are also anti-estrogen drugs.